Good evening to everyone. On behalf of Association for Veterinary Dermatology India and Intas Pharmaceuticals, I welcome all of you for our dermatology webinar. We are very much proud to be a provisional member for World Association for Veterinary Dermatology. Recently, they have recognized us as a provisional member for World Association for Veterinary Dermatology. We are we have a lot of works to do in future, and we have a lot of commitments to do. So we'll do it without any interruption. And today we, as usual, we are going for a new approach in the webinar. Particularly today, we have an interesting topic, Petside diagnosis in dermatology. Actually, we thought every part of the veterinary faculty should be there, like veterinary faculty, veterinary practitioner, or industry people. Everyone should be contribute in our webinar. So in that we have today we have got our great speaker, our great friend and vice president of our Association for Veterinary Dermatology, Dr. S. Venkateswaran, who is a very good practitioner for a long time, and he has got very good keen interest in dermatology. That's why he became a vice president in our association, and he has contributed a lot, and he has got very good collection. I used to wonder whenever he is going to post any picture. So I'm very happy to introduce our Dr. S. Venkateswaran by Dr. Nitin Bhatia. Dr. Nitin Bhatia, I also welcome all the Intas group, Intas team, Dr. Amanjot, Dr. Ravindra Prasad, and also Dr. Nitin Bhatia for this show. And I request Dr. Nitin Bhatia to introduce Dr. S. Venkateswaran.
We once again welcome each one of you for the webinar on Petside diagnosis, and we have one of the good speakers today. He's a practicing veterinarian at Coimbatore, and his clinic is known as Cottonside Clinic. So he is a mentor for many people in the southern India, how to go ahead with an enterprise and how to go ahead with the creation of a veterinary pet practice. So I don't keep you all waiting, and I give over the stage and the dais to him to speak on Petside diagnosis for effective canine dermatology as well as companion animal dermatology. So over to you, sir, for your elaborate lecture.
Sir, thank you. Thank you. Thanks, Dr. Nitin Bhatia and Dr. Nagarajan for introducing me. I'm not a great speaker. No, probably. Now the thing is, I'm practicing for almost 3 decades. In that way, maybe I'm great, but not a great speaker or anything. But anyhow, from my academic experiences and my practitioner experiences, I'm going to reveal what I'm going to do it. In fact, the topic also, when we decided what type of topic we should go, we thought that being a practitioner, now it should be from a practitioner side, how we are going to do it on the side of the dog itself without having too much of equipments or the laboratory works and other things. That was the reason the topic selected was Petside diagnosis in small animal dermatology. So definitely what I am going to speak will be more useful to all the practitioners who are in the field level without having much of an infrastructure or the laboratory facilities. So today the current scenario, now being in the pandemic situation everywhere, now everyone should be now facing the same situation, and in fact I request everyone to keep safe while you are practicing or while you are at home or anywhere. And because of this pandemic situation and work from home, work from school and other things, now people, now they have more time, and then they have gone in for a more number of pet also. In the pandemic situation, now any industry or not, pet industry has developed so much that number of pets have increased and newer pet parents also have come. So, and because of these newer pet parents, the ignorance on the management of pets is also there. So that's the reason more amount of pampering and the pets are more humanized. And because of the humanization of the pets, the environment and nutrition is also changed, wherein they are fed everything, whatever they eat, and they are giving the comforts of the same thing which are given to the human beings, and leading to so many other diseases, of course, more importantly on skin diseases also because of the environment and the malnutrition factors. And whenever you come to the diagnosis, as I said, no, it's a Petside diagnosis, what we meant is, so it should be easier for everyone. So in that, the history taking, definitely that is going to help us more in getting the inputs from the dog owner as well as on the dogs also. And the next is physical examination. After taking the history, we have to look into the animal from the physical side, and then collect samples for the macroscopical examinations, and then later into microscopical examinations. In fact, these are all the ones I'm going to concentrate more as a Petside diagnosis. Maybe for advanced things, we may go for biopsy, hemogram, biochemical test, and culture also to add to our diagnosis or to confirm the diagnosis. Next. So while coming to that history taking, the age, now definitely the first question which we will be asking is what's the age of the pet, because it also adds to the diagnosis of the conditions. So when they are very young, so they are more prone for congenital or hereditary diseases, and dermatitis, localized is also very common, dermatophytosis, and the juvenile cellulitis, again, which is also very common when they are very young. And the next stage, that is 6 months to 3 years, we can expect more of atopy, a primary seborrhea, histiocytosis. And in the next level, when they cross the 3 year of age, when they come to that middle stage, the more common is Cushing's or the neoplasm. And of course, in the old age, the hormonal disorders happen also, and they also cause the diseases. And then when coming to that history taking, the history taking, again, the next is sex, the age and then sex. Sex, of course, doesn't have much of effect on the dermatological conditions, but certain things like pregnancy stress and the lactation stress, they cause the telogen deflection, wherein you can see more number of hair fall, and that also will be very visible. Say like these things here. You can see the thinning of the hairs, which is a telogen deflection, which is very common after pregnancy or the lactation stress. And then again in the sex, the Sertoli cell tumor, so that also causes a problem. The gonadal dysfunctions, again, they also lead to alopecia and other skin conditions. And then in the Sertoli cell tumor, now in fact, we saw this case 3 days back in our clinic. It's a German Shepherd, intact male, 8 years old, came to us for the history of vomiting. When we went for the physical examinations, we were able to see this a linear erythema from the scrotum to the penis, which is one of the pathognomonic symptoms of a Sertoli cell tumor. Apart from that, you can see the smaller descended testicle and the gynecomastia also, the enlargement of testicles. And then later we confirmed this with an ultrasound pictures also of the retained testicle, a tumorous one, which we are going to operate in the coming week. Probably after that, I will be posting it in our groups. Next in the history taking, the food. The food also plays a major role. As I said, the pampering and the humanization of it. We are feeding the pets with more of the human food, leading to the deficiency of vitamin A, fat and protein. So they also cause a problem as far as the hairs and the skin coat is concerned, because every hair contains almost around 60 to 75% of the protein, and the diet, which is the protein in the diet, almost 40 to 45% is utilized for the skin and hair coat. So when the food is deficient in protein, definitely it is going to affect the skin conditions. And then more often, we are seeing more people going in for a vegan or going in for a plant protein. When they feed the dogs with pulses, soya and cereals, definitely they lead to a zinc deficiency and going in for zinc responsive dermatitis also. So the food, so while we are taking that history, the food also plays a major role. And the next is genetic. Genetics, of course, the hereditary, and the hereditary, again, the atopy is the major cause for it. So we have to go in for this history also. And then in the next history taking, baiting, again, the humanization comes here also. So we have to ask them how often they are baiting him. and what type of shampoo they are using. So when they are frequently bathed, again, it affects the skin condition, the hair coat is lost, the shine is lost, and they also lead to other dermatological problems. And similarly, the shampoos also, the human shampoos, which have more of detergent action, again, it affects. So the bathing also gives us a clue in aiding in the diagnosis of our condition. And then the environment. And now the next question we have to ask them is where the pet is kept, whether it's an outdoor or an indoor, or what type of house they have. Like now, if it's a garden like which have more of a plant, the pollens and other things may cause a problem, which may give us a clue. The same way in the farmhouse, they may have some other rodents and the other animals also apart from the plants, which may also give them the parasites and allergic materials, and that will also give us an idea. And similarly, as far as solar, pets like which are albinos, they also suffer from the solar conditions when they are kept in outdoor exposed to the sunlight. So this also gives us a good idea of coming to a diagnosis. And then the progression of the disease. In our history taking again, so this also gives us a clue. Now we have to ask them when the problem started and then how it progressed, whether it is very rapid or slow or the other things. When it is rapid, we can think of parasites like scabies, and then even the flea bite allergies also. And infections again causes a rapid progression of the disease. The autoimmune diseases also are rapid in progression. When the progression is slow, we can think of allergy, endocrine, and neoplasm. And then the waxing and waning. The thing is, the dogs will have the problems and then go off. Again, they will have it after some times. Invariably, this is due to the allergy. This also gives us a clue. Apart from that, the occurring of the disease, when it is seasonal, we can think of atopy, parasites, and plants also, because plants, some of the plants, they flower in seasons. Those seasons, the dogs will have a problem. So that also gives us an idea. And then now, after finishing this history taking, the next step we are going to have is physical examination. In the physical examinations, we can look into the changes in the skin color and then the changes in the clinical manifestations also. As far as skin color changes, now we can see an erythema. You can go in for, we can expect allergy, parasites, and immune mediated diseases, wherein the itching is more, they go for a scratching and then making it as erythematous patches on the skin. And then the next is hyperpigmentation, the change in the color when it is hyperpigmented. We can think of malassezia, endocrine, acrylic. Now when they keep on licking, that salivation also makes it more pigmented, and then the color is also changed. The flea dirt on the dog's body also gives us a change in the color whenever water is applied, or when they're going for a bathing of the dog might turn into red. The people think that the dog is bleeding from the skin, but invariably the flea dirt gives them the color of the blood when it is bathed or when it is put in water. And then the next hyperpigmentation we can expect in Demodex also. So in Demodex, unlike malassezia, the color will be lighter, because the melanin pigments are more, and the epidermis giving them a darker color in malassezia, whereas the melanin pigments are placed in the dermis layer. That's the reason in Demodex, the lighter shade in the, as far as hyperpigmentation, we can see it. And then the next is in hypopigmentation, the lighter color is we can see it in vitiligo, autoimmune diseases, neoplasia, and again in nutritional disorders also. And then which this now we are very commonly occurring now, the petechial hemorrhages in the abdomen or in the eye or around the pinna. It's more common in viral diseases and the vector-borne diseases, which we are encountering more, like ehrlichiosis, babesiosis. We are encountering more of this petechial hemorrhages, which is also a symptom of the internal diseases which the dog is harboring. And ecchymosis, again, the larger patches, again, which are seen in vector-borne diseases like ehrlichiosis and babesiosis. And then when coming into the physical examinations, apart from the color, the clinical manifestations, so that also gives us a clue in diagnosing it. When the dog is put on the table, again, this also helps us. The lethargy, invariably the lethargy is due to the canine hypothyroidism, and in parasitic diseases like scabies and pyodermodicosis, where the itching is more, the dog doesn't want to do any work, lie down in a corner, keep scratching. And then in deep pyoderma, again, the amount of itching is more, that makes them more lethargic. Mycosis, the fungal diseases and the autoimmune diseases, and because of this itching and the scratching pruritus, the dogs become more lethargic. And then the next, the weight gain. So that is also there. In the weight gain, invariably you can think of a hypothyroidism and hyperadrenocorticism. Again, in the weight loss, you can think of neoplasia and diabetes also. Polyphagia and polydipsia, where they drink more water and food, you can expect them in hyperadrenocorticism, hypothyroidism. Of course, in steroid administration also we can encounter this. And then whenever you find them coughing, we have to think of mycosis, neoplasms in the respiratory tract, as well as the nematodes larva also may cause the coughing. And sneezing is due to allergy and then aspergillosis. And then the GI signs like vomiting or diarrhea due to colitis in adverse food reactions, we can see it. And again, the clinical manifestations, the polyuria, hyperadrenocorticism is one of the factors for it. And then in the next clinical manifestations, we can look into the sexual behavior also. In the sexual behavior, again, as we discussed earlier also, it's not giving us more of a clue, but definitely the manifestations will give us an idea of it. The reduced sexual behavior is in Sertoli cell tumor, hyperadrenocorticism, and hypothyroidism. And again, the altered estrous cycle also, we can see it in hyperadrenocorticism and ovarian tumors. In ovarian tumors, we can see it a longer cycle or a non-cycle or a shorter cycles also. We can see them as far as the skin conditions are concerned. And then the lameness. The lameness also will give us an idea about the problems which they have on the dermatology. The pododermatitis, definitely whenever they are making any movements, the lesions in the digits will cause them pain, and that also will make them lameness, which are due to demodex and ankylostomes. The ankylostomes larvae also, they cause pododermatitis, causing a pain leading to lameness. And then in the interdigital furunculosis, again, a huge pain will be there. And that also the dogs will be lameness. And when they are lameness, we have to look into the foot pads for the keratosis. And then the fissures, they also cause the lameness, and neoplasms in the digits, and systemic lupus erythematosus, again the huge pain and the iritis, and onychodystrophy, even the fungal infections of the nails, they also cause lameness. And the last one, the Spirocerca lupi. Now again, everyone will be thinking how Spirocerca lupi is going to cause a lameness. In fact, we attended a case 2 years back of a Labrador, middle-aged Labrador coming to us with the lameness in their hind legs, and they were not able to. And even stop the video. Now, in fact, we tested it for 2 to 3 days. It had all the parameters were normal. And then later on the third day, when we were examining the skin, since the skin was having some other problems, we could find some small holes in it. And then when we poked it, we removed the Spirocerca lupi. And later it was diagnosed as the spirocercosis, even having the tumors in the spinal column as well as in the vertebra, which may cause this lameness. And of course, we couldn't follow up the case because the owners didn't turn up after that when we had planned for a CT scan to find out where exactly the lesion is. But we were able to remove the Spirocerca lupi from the lumbar region of that the dog, which was causing a pain in the leg and leading to lameness also. And later we confirmed it with our parasitology department also of the Spirocerca lupi. So again, now this also may cause the lameness in the dogs. And then in the clinical manifestations, again, the seizures could be due to cryptococcus and hyperadrenocorticism, and the head tilt due to otitis externa or the media, and nystagmus again from the otitis, and the ocular discharge, that also is very common in allergy, epiphora, and then oral discharge, again, either a pus or a bleeding from otitis externa and the media. And tail chasing, again, this is also one of the very common symptoms which the owners will be encountering and telling us also whenever we see any lesions in the hindquarters or in the perineal region. The anal sac disorders, they cause the tail chasing. That is also one of the a diagnostic factor which can be seen on the table itself. And then the next clinical manifestation, again, which is very common and which is, of course, complaints from the owners very common is alopecia or the hair loss. And then in the alopecia, again, we can think of if it is patchy, it is due to the localized dermaticosis. In this pug, a small patch in the lumbosacral region had a demodex, and then dermatophytosis. Again, it will be in patches, and the bacterial origin, staphylococcal, they also cause a folliculitis, which will be patchy. Injection reactions. In fact, this one came to us after an injection of anti-rabies vaccine, and in the vaccine reactions, we can think of more in cats, that is feline injection site sarcoma, and especially due to the anti-rabies vaccine because of the preservative factor which is being used in the anti-rabies vaccine. And steroid injection sites also will cause patchy alopecia. Of course, post-clipping alopecia also is common in patchy manifestations. And then when you go in for local alopecia, limited to certain reasons like, so nowadays it is very common for the Shih Tzus and the hairy breeds to come with the hair clips and rubber bands, which the owners, they love it. And they cause an alopecia and a slight erythema on the base because of the traction which is being applied continuously. So we may have to suggest the owners to go in for this, not a complete one, maybe when they take out, or not always, like whenever they feel like they can have it, or better to avoid a hair clipping or rubber band, which will cause them problems. And if you see any local alopecia around the neck, it could be due to the even belt also. The belt or the leash which they are attaching onto the dog, which is never removed, and with sometimes they even bathe the dog along with that belt, and the inner side of the belt will be harboring those detergent remnants, which will cause them problems, and that also will cause a local alopecia around the neck. And then the growth hormone responsive dermatitis also will have problem, the local alopecia around the neck, apart from the other areas. And then as far as Dachshunds are concerned, it's a breed character, and they have alopecia on the base of the pinna. And when you have this alopecia in the base of the tail, most of the times it is due to the tail gland alopecia or the hepatoid glands in the tails, or even sometimes whenever they have a problem in the pruritus in the perineal region, they keep biting, whenever they do the tail chasing, they keep biting the tail and causing this alopecia. So we have to look for perineal region or the hepatoid organ problems when you have a problem of the base alopecia and the base of the tail. And then whenever you have a alopecia on the dorsum, think of ectoparasites like ticks, fleas, and tick nymphs, which are also very common, and sedaceous adenitis also cause the alopecia on the dorsal side of the dogs. And then the rat tail. Of course, though it is not a pathognomonic, it gives us an idea that dogs suffer from hypothyroidism. And then the genital areas also, when they have a gonadal disorders, the genital areas will have alopecia, which are localized. And then whenever you have this symmetric alopecia, so definitely it is a hormonal one. In case of a hormonal one, initially it is non-pruritic. They will not have any lesions, no reddening, nothing will be there. So whenever you encounter a non-pruritic symmetric alopecia, invariably it could be a hormonal one. And neoplasia also, again in Sertoli cell tumor or any other one, we can see the symmetric alopecia. The same way, the castration responsive also will have symmetric alopecia. After the castration, it should respond. And next, in alopecia, when you see it as a diffuse one, now you can think of the hereditary or the other ones like black hair follicular dysplasia, which definitely you will be encountering more in younger puppies. You can see this, especially the alopecia will be in the black colored skin only. And then some of times the color dilution alopecia, and even in the older dogs, now you can see the graying of it, that is a hypotrichosis. So that also will give them an alopecia. And pattern baldness, definitely again is a genetic one as far as Dachshunds and other breeds are concerned. And then the alopecia, the congenital one, of course, this is very rare, and we don't have much of these breeds in India. Like Sphinx cats or Chinese crested, I have not seen much. But this particular one, now this Jonangi, an origin from Andhra. I have seen it in Coimbatore also. They have very short hairs, looking like a genetical one. Now, invariably, if we are not knowing about this breed, now we will be thinking of some skin disorders, and then we will be trying to treat it by doing scrapings and other things. But this one, definitely a lovely dog knife which I have seen. One or two of my clients are having this Jonangi, so that also a genetical one, which will have a lesser hair, very small hairs. They have very short hairs. Now these are all the congenital ones as far as alopecia is concerned. And then in alopecia again, the next one. Now the common the query we get it from the dog is, my dog is shedding too much of hairs. Now, in fact, I always used to tell them that it used to be, but only when it goes into a bald patch, it may be a problem. But normally, this amount of a huge amount of hair loss will be there more in the telogen deflection and anagen deflection. Anagen deflection, in fact, this is very rare only, and telogen deflections, which are very common, and they are present more in dogs and cats. The one is the sudden heavy loss. That is the one which will be worrying the owners, and they will be complaining it to you. And definitely we may have to answer them why there is a sudden heavy loss. As far as anagen deflection is concerned, so in that the sudden stoppage of growth in the anagen. So that's the reason they shed it, and then we have this alopecia in it. And usually it used to be abnormal in shape, and in trichogram we can see the anagen bulbs. And this is very common in oncological therapy, especially when they are given anti-mitotic drugs. But normally, whenever you use our Venkateswaran or doxorubicin, we are not encountering much of this alopecia. Maybe rare, we may encounter it. So in such cases, we may have to tell the owners, whenever we are going in for it, your dog may encounter an alopecia, which is an anagen deflection. And in anagen deflection, invariably, it used to be diffuse and more common in dorsum and flanks only. The next one, telogen deflection. Definitely, this is very common. Every one of us should be encountering this in our practice. And this is not only due to metabolic stress, and in this, a sudden synchronization of the hair cycle will be there. So all of them will be going into the telogen phase, and sudden heavy loss will be there. You can see the molting on the flank as well as on the dorsum side also. And invariably, this you can see it, say 1 or 3 months after the pregnancy or the lactation, or even during the proestrum also. 1 to 3 months after it, you can encounter this, but not suddenly. It's delayed only. And some of the systemic diseases like pyrexia, they also cause telogen deflection, and surgeries also cause it. And whenever you go into the trichogram, you can see the telogen bulbs in that also, and you can see the plenty of telogen bulbs in it, and that is giving us an idea of the dog is going in for a telogen deflection, maybe due to the systemic diseases or due to the heat cycle or a pregnancy or the lactation, which may also cause this telogen deflection. And for this, nothing to worry about it. This will come back to normal. Maybe if they are deficient in nutrition, if you could supplement them, they will come back normal. But normally in this telogen deflection, very rarely they go into a bald patches. Otherwise, we will not be seeing it much. Only thing we will be encountering is too much of loss of hairs, sudden onset. And in the next clinical manifestations, the thing is, apart from the alopecia, the next we can go in for is pruritus. The pruritus, again, we have to look in for it. We may have to go for the entire examination, starting from the pinna. So in the pinna, whenever you have this pruritus, you can go in for this scabies. You can suspect a notoderus, otodectus, and malassezia, and they are all the ones which will cause pruritus when it is present in pinna. And the next one, when you go into the dorsum, the pruritus is more due to the ectoparasites only, like ticks, fleas, Chiliotella, and sebaceous adenitis. They also cause a pruritus on the dorsal side of the body. And the pruritus, when it is there in the base of the ear, you can suspect for oral mites. You might have seen when the pups are brought for the vaccinations, just lift up the pinna and then look into the base of it. And whenever you have any alopecic patches are there, definitely the dog would have gone for a scratching because of the pruritus inside the ear, which is caused by the oral mites or the ticks in the ear. So that will also give us a pruritus. And you have this pruritus in more in elbow and hock. We can suspect for rabies, and the pruritus in the lumbosacral region in the back. So you have to suspect fleas. And when the pruritus is in the ventrum, we can suspect for scabies, malassezia, and then even the contact allergies like detergents, floor chemicals. They also cause pruritus in the ventral side of the abdomen. And again, in the pruritus, no, this one, in fact, I read it in a webinar, the Henry's pocket, especially in the ear, we can see this small packet, and which is harboring the trombicula. And the trombicula, whenever you are suspected, you can go into the this Henry's pocket. You can see an orange colored deposits are there. When you take it, you can see the trombicula larval stages there in the Henry's pocket. Apart from that, in the Henry's pocket, the ticks also get large. That also will give them an irritation. And then when you have this irritation in the perineal side, the adverse food reactions, again, you have to think of it. Now they cause initially the anal pruritus or the perineal pruritus only. And then in anal sac disorders also, you have the pruritus in the anal side. And then the non-haired ventral side, that is almost on the hindquarters of the ventral side of the abdomen. And when you suspect pruritus there, it could be a contact allergy, the detergents and the floor chemicals. Because of the lesser hairs, the skin is more exposed to those allergies and causing more problems there. And especially as far as detergents are concerned, when they are not bathed properly, the remnants of the detergents will cause a problem. And during summer, the dogs prefer to lie down on the bathrooms when the floor is wet or when it is cool like, and that detergent may cause a problem in that area. And the floor chemicals, of course, we are more obsessed that the floor chemicals only save us, and that also caused more problems, especially phenyl and Dettol. And then one more one. See, you can, whenever you suspect, as far as cats are concerned, the tip of the tail, when they have the pruritus, you can think of oral mites also. Now, because dogs, the cats, when they lie down, they curl around, and then the tail is almost touching the ear. And from the ear, the oral mites or the trombicula or the ticks might go into the tail tip, causing a problem of that also. And then in the pruritus, again, the next is intertrigo, which is very common in the brachycephalic breeds and the obese dogs. Especially the brachycephalics, you can see it in the face, and because of the close opposition and the aberration happening in that wound, you can see lesions here and the pruritus also. Apart from that, you can see it in the facial fold and then the vulval fold, and in the body also when they are obese, and then in the tail fold, you can see them, and very common in the brachycephalic and in the obese breeds. And as far as pruritus is concerned, some of the reflexes also gives an idea what type of infection they should be carrying it. Every one of us know about the pinnipedal reflex in case of scabies. That's the reason I didn't go for a video of this, because every one of us know it. As far as the otodectus, the oral mites, they will have this auditopedal reflexes. So whenever you touch the base of the tail or clip it, or whenever you are taking a sample using a earbud from inside the ear, the dogs will have this pedal reflex, giving us an idea of the otodectus or the oral mites. Again, when you rub the lumbar surface in any dog, now when they carry the ticks, nymphs, allergies, even the sebaceous adenitis, they will have this the pedal reflex. So that also gives us an idea of the pruritus in the lumbar region. So this gives an idea how to go about it next. And then in the clinical manifestations, some of the things, of course, these are all benign tumors, not causing much of a problem, only a cosmetic cause only. So this one, a cutaneous horn, which we normally seen in the face and in the digits only. It's a mass of keratin, of course, from the any carcinomatous or keratosis leading to these things, which is a cause for it. Maybe a surgical removal will give them a relief. Otherwise, it's not going to harm them in any way, only as a cosmetic concern only. The next one, this is also very common. So this is in a pug, which is almost 3 years old, having this skin tax. Again, this is also not a problem. There's a benign tumor only, which is a fibrovascular papilloma, and not causing any problem. Maybe we can remove it surgically for the cosmetic purpose. And then this one, this is also very common in the older dogs, calcinosis circumscripta. In fact, we have this is mainly due to the dystrophic calcification due to a repetitive trauma or a longer duration of a trauma. These are all very common. Invariably, this is present in the pressure points, the foot pads, and in the injury sites only. And the other one, the clinical manifestation, epistaxis. Now this one, in fact, we encountered this dog almost 3 or 4 years back. This dog was bleeding from the nose, and this dog had a history of tick-borne diseases. And the owners, they are from the Milfrey. They worked in different places. Probably our Dr. Piyush in Bilaspur, he has also attended this case for the tick-borne diseases. And then after that, after 2 months, when they came down to Bangalore, again, this was treated for vector-borne diseases and then recovered. Again, when they came to us in Coimbatore, also they stayed in Kunnur nearby. And then that also at that time they had this epistaxis, we treated it. And then after a month, again, they came with the history of epistaxis. Again, we went for the hemogram. The hemogram, it showed us very low thrombocytes. It was almost 10K. Again, we treated it. The bleeding never stopped. And then on the third day, again, the owners came from Kunnur, which is almost 50 kilometers from my area, saying that they could see some muscular structures inside the nostril. And then when we went for a final, a closer examinations, we found out that it's carrying a leech in the left nostril. In fact, when we asked them the history, they had taken the dog to a nearby jungle, had a jungle stream also. Probably the dog could have got this leech from it. And then we removed it just by pouring water over the nostril, and the leech, when it popped out, we removed it using an artery forceps. And this was causing a problem in the nostril, and the dog had a huge irritation as well as a bleeding also from the nose, and which we could see a sigh of relief after this was removed from them. And then we checked it for the next 2 or 3 days. The bleeding stopped completely. And again, people who work nearby jungles or a jungle stream, whenever they have this epistaxis, they can think of leech, and then they can look into a diagnosis of this also. And of course, though this is not directly connected and leading to an irritation in the face and in the nostril, I thought I can add this slide and the video also. Next. And then after the physical examinations, the history taking, physical examinations, we can go in for macroscopical examinations. In the macroscopical examinations, initially we can go for a coat brushing. The coat brushing can be done using a flea comb or a brush. So when you brush it, now of course the scales, the ticks, the fleas, the flea darts, everything will be coming. And this one you can see a dog which was heavily infested with the fleas. So much of the flea eggs were there, which were white in color, and in a microscope this was visible. So, and when we closely examined it, now it had some of the flea larvae also, which was present on the dog's body. And then the flea dirt, and this also you can see from the coat brushings. And then you can use a hand lens or a microscope after the coat brushing is done. From the microscope, of course, we can see and in the hand lens also the ticks, nymphs, the flea dirt, curliatella, the eggs of flea and louse, which I have mentioned now. And then the coat brushings, which will be more useful for taking samples for fungal identification as well as culture also. And then the next one, which can be done on the dog's table itself, is a wood slamp. The wood slamp, of course, this is more of a fungal infections. Of course, at the same time, bacterial infections like Pseudomonas also can be diagnosed using a wood slamp. And the skin pigmentations, irregularities like vitiligo, again, can be diagnosed by wood slamp. And corneal aberrations, which we did it in our clinic. So this was also diagnosed through a wood slamp. Of course, not a diagnosis, which will be aiding into the diagnosis also. And then the wood slamp gives us, helps us to collect samples for the fungal culture. As far as wood slamp is concerned, apart from that, we have to go in for a dark room, and we have to wait for 5 minutes for the machine to get to that level, as well as the eyes, for our eyes also to get used to that vision in the darkness. And the wood slamp in the darkness, the fluorescent metabolites produced by those fungus gives us this apple green fluorescence. And initially we can see the entire hair bulb also, including the bulb, glows with the wood lamp. Maybe in the course of the treatment, again, when we are going in for it, we may see a very few positive ones, or we may see the fluorescence in the tip or in the distal shaft only. And again, when we have to look for it, whether they have completely cleared or not, we can use the wood lamp near the eye and ear where the nidus will be there. Again, they may go in for a fungal infections. And the wood lamp, in fact, it's used in the wavelength of 340 to 450 mm. And some of them, if you don't have a wood lamp, you can even try the smaller UV light, which is being used to detect the fake currency notes. So that UV light also can be used for going in for this fungal diagnosis to look out to the fluorescence. And for the wood lamps, we have to pluck hairs, place it on the or drop of a mineral oil. Again, that also you can see it directly with the fluorescence with a cover slip. 4x, 10x and 40x again can be used to detect those things. And in the next to macroscopical examinations, which is very easy, again, diascopy. Maybe terminology may be looking a different one or something like in this only two things are needed, a clear glass light and our good eye vision only. So whenever you suspect these any of ecchymosis or any other bleeding disorders or anything, you can use a glass light. Just apply pressure over the lesion. If it goes into blanching, it is a positive one. If it is a non-blanching, it's a negative one. As far as the positive blanching is a normal one, which is due to the vasodilation causing erythema. Invariably, this is due to urticaria only. So in urticaria or in any allergic reactions and erythema, you will have a positive blanching, and that is very easily diagnosed. Also, we can go in for the treatment. And when you have this non-blanching, you can suspect cutaneous adverse reactions, coagulation disturbances like petechia and ecchymosis due to the vector-borne diseases or due to the viral diseases, or in the lymphoma, the epitheliotropic T-cell lymphoma, cutaneous vasculitis, again, that can be diagnosed with that. Erythema multiforme, again, and again another autoimmune disease. Diascopy will be very useful. As I said, it's a very good, easy, Petside diagnosis. Just a glass light, a clear glass light, and a good vision from us can diagnose these conditions. And then in the next macroscopical examinations, we can go in for this trichogram, fecal examinations, cellotaping, skin scraping, cytology, and FNAC. That also can be done. And of course, I will deal one by one, starting with trichogram. Trichogram, again, it's a very easy Petside diagnosis. What you need is only an artery forceps, a slide, and a mineral oil and a cover slip. That is enough. And whenever you suspect any alopecia, pruritus, or scaling, you can go in for a trichogram. And the microscope, you can see it right from 4x, 10x, and 40x also. And in the trichogram, now you can see the parasites like Demodex, of course, where now this Demodex was attached to the bulb of it, and then you can see the eggs of pediculosis, the trichodectus, you can see it, and then this was a fermite in a cat, Linzacarus radowski. You can see in this an egg, a larva, and an adult also using a trichogram. Of course, this will be even from the tape and other examinations also you can see, but trichogram aids in confirming these diseases. And then in the color dilution, alopecia, dermatophytosis, again the trichogram is more useful, you can say it. And then when you go in for trichogram, now you have to collect the samples, put it on a slide, fix it with a mineral oil or a cover slip, and then look for anagen, telogen, and when you look into the bulb of it, you can find out whether the hairs are in anagen phase or in the telogen phase. And then you can see in the bulb, you can see the Demodex mites. Of course, the Demodex mites can be seen not only in the bulb, in the shaft also. And then in the shaft of the hairs, you can see eggs, debris, the fungal spores, melanin granules. Melanin granules give us an idea of So it's like this, you can see it. Now, otherwise, it's normally arranged in a serial pattern, and when they are clumped, and you can suspect for color dilution alopecia, or even an aged ones, that alopecia also, the fading color alopecia also you can see it. And then you can look for the breakages of the hairs. Now this gives an idea, especially as far as cats are concerned. Cats will not show us that they have this irritation or the pruritus. But when you take a sample, whenever you are seeing these breakages of the hairs in that, you can think of a pruritus, and that could be one of the diagnostic cause for it also. And then into that, after that, the bulb, the shaft, and then tapering of the tip. So when you find the entire one, this is a normal shedding. When you find a bulb, a hair shaft, and a tip tapering also. Next. And then in the macroscopical, apart from trichogram, the next is feces. The feces also give an idea of what type of the skin infections they have it, especially when the pruritus is more like scabies or in the dust mites or even in notoderus. When they keep on biting, they ingest a part of it also. The parasite is also ingested and excreted in the feces. Again, in the fecal examination also, you can get an idea of what type of things. In fact, all of them, these two dust mites also, we got them from a fecal examination of a pug, and this Sarcoptes again in the fecal examination, and the Demodex also in the fecal examinations, you can see them. So whenever you are suspecting any skin disorders, even the fecal examination also will aid you in diagnosing them. Next, in the macroscopical, very easier, and the one which can be done in any clinic is the sellotaping. What you need is only a clear sellotape, a slide, and a microscope to see it. Whenever you suspect any pruritus or scaling, you can go in for this sellotaping. And pediculosis also, of course, in pediculosis we can look into the egg and the larval stages, and Chiliatella, Trombicula, Demodex, Sarcoptes, Notoderus, even the dust mites also can. In this particular dog, when they had this lesion on the right shoulder, and when we went for it, we were able to see this dust mite in it. So a sellotape gives us an idea, and which is better also. Now, if you are able to get the diagnosis of Demodex or any other thing, you need not have to go for a deep scraping, avoiding, because the owners also will be objecting it, or they may not like to go in for a deeper scraping. So first you go for a sellotaping if you could diagnose a Sarcoptes or a Demodex, which will avoid you to go in for a deeper scraping or the other examinations which will be causing them pain. This is a non-invasive, a painless, and a very easier way of diagnosing the ectoparasites. And for the sellotaping, if they have more a longer hair and other things, clip the hairs and then squeeze the sampling area to bring out the material onto the top of the skin, and stick the sellotape onto that lesion, transfer it to slide, examine it in 4x, 10x, and 40x. Of course, in 4x and 10x itself, you will be seeing all the parasites. In 40x, maybe if you want to see more of their structures and other things, you can go in for a 40x. And then the next macroscopical examinations, which you can go in for skin scraping. Normally, when I get a negative in the skin, in the sellotaping or in the trichogram, I go for the skin scraping. In the skin scraping, you have two type of one, a superficial and a deep scraping. And for both of them, what you need is you can go for a scalpel or you can go for a backpacker blade. And in the superficial ones, now whenever you suspect a scabies, the superficial scraping is more useful, and you may have to go for a larger area. And for this superficial scraping, just dip the mineral oil on the blade and then rub it against the skin, and then take the scraping, transfer it into the slide, and then look for Chiliatella, Trombicula, even otodectus. When it is more, apart from the ear, they migrate to the face, and as I said, in the tail tip also, you can look into that. Sarcoptes and Notoderus are very commonly seen in a superficial. Of course, in many times, even the Demodex are also visible in the superficial scraping itself. Again, when you get a negative one, go in for a deeper deep scraping. And for the deep scraping, the smaller area itself is needed where the lesion is there. As I said earlier, clip the hairs, squeeze the area, and then go for a scraping but you have to go for a multiple scraping till the capillary bleeding is there. Then only you will be recovering the parasites from the dermal side, and the Demodex is very commonly seen. You can see whenever you go for it, you can see the entire life cycle of the Demodex also, because that also gives us an idea. Whenever you see a Chiliatella, a Trombicula, or a Otodectus or Sarcoptes, they are not a commensal parasite. So even when you see one parasite, you have to take it as a disease condition, go for the treatment. As far as Demodex is concerned, it's a commensal. Many dogs carry it. Even some of the human beings, I am also carrying a Demodex in my face, which we have seen it in our clinic. And then the Demodex, just by seeing a single Demodex in the entire area may not be causing a clinical problem. But when you see a family of it, a egg, a parasite, and all the developing stages, definitely we have to treat them as a clinical case. And then in the macroscopical examinations, the ear swabs. The ear swabs, normally it's a cotton swab, taking it from the ear, which will for the diagnosing of an oral mite, and then the bacterial infections, yeast infections, they can be taken from the ear swab. And a sterile cotton swab, dip it in mineral oil, take it from the ear, and then look for the Otodectus. Now, Dr. Nagarajan also said, of course, I didn't go for the video of it. Now, in this particular cat, now we almost had thousands of should be there. The entire ear was totally damaged. Of course, I don't have that picture, otherwise I would have given it also. And then we saw plenty of eggs in it, apart from the Otodectus mites also. And then as far as for the bacteria and the yeast, you need not have to go for the mineral oil dipping. Just straight away insert the swab into the ear, collect the sample, spread it onto the slide, and then stain it with methylene blue or any other stains which you have it. You can look for Malassezia as far as the short chain rods or the cocci in it. And then in the next macroscopical examinations, which is very common or which can be easily done at the clinic, is the cytology. The cytology is looking into the cell pattern or the structures in the lesions which we are going to see. This can be done using an adhesive tape, an impression smear, a cotton swab, or the fine needle aspiration cytology. And then in that, the adhesive tape, again, it should be clean. And what you have to do is select the lesion, stick the adhesive tape onto that lesion, press it till the bleeding is there, transfer it into the slide, or you can stick it onto the tip of the slide, and then the tape will be hanging from it, and then you can use it in the dipping for the staining. You can dip that into the staining materials, and then you can stain it, and you can see it. Or you can take the after sticking and pressing onto that lesion, before transferring it to the slide, place a drop of methylene blue and then stick it, and then you can straight away see it for the Malassezia and other organisms in it. Of course, when you are using this methylene blue, you will not be seeing RBC or a WBC, but you can very easily see a Malassezia or a cocci or a short chain rod. And then in the next cytology, the impression smear. The impression smear, of course, again, the lesions, straight away you can take the smear by pressing the slide onto that lesion and then transfer it. When you do it frequently, the smear will be very thick. You may not be able to sew it. So you just press it once and then you can stain it, and then you can look for the organisms or the causative agents in that. The next is cotton swab. The cotton swab, of course, we said we can use it for the ear. Apart from the ear, even on the other lesions on the body, you can use it. A sterile cotton swab, either by dipping it on the lesions, or whenever they have a sinus or a fissure, you can insert it into that and then take it, roll it on the slide, and then you can stain it. And you can fix it up with the methanol, or you can go in for a heat fixing, and then you can stain it and then look for the causative agents. The next one, the fine needle aspiration cytology. Again, for this, you need not need a good infrastructure or any other thing. Just a needle and a syringe is enough for it. And these things are useful whenever you have a cutaneous lesions. You can take the fine needle aspirations and then look for it. apart from that, you can even take it from the lymph nodes also. And for this, you need a 20 to 22 gauge needle, either a 20 or a 22 gauge needle, a 5 ml syringe. Spirit for sterilizing the area before taking it. And while taking it, you hold that either the lymph node or the lesion firmly and then pierce it using that needle, and then you can take it. And whenever you are piercing it from the cutaneous lesions, take it from the non-septic region. And otherwise, you will have more of contaminating ones like neutrophils and others will be there. You may be missing the main causative agent. And then in the fine needle aspiration, you have two techniques, either an aspiration technique or a non-aspiration technique. An aspiration technique is next. In the aspiration technique, you are going to have it with the needle and the syringe attached to it, and the needle is inserted into that area, and then the pressure is created by removing the plunger in different areas and then taking out the needle, and the syringe is fitted with air, and then transfer it to the slide, prepare the smear, and then you can do it. So in this, whenever you are going in for an aspiration, there is a likelihood of a contamination of blood, diluting the smear and then making it more difficult for diagnosing which is the causative agent. So instead of using this aspiration, you can go for the non-aspiration technique. In the non-aspiration technique, again, there are two types, either a needle alone or a needle fitted with syringe. When you use it, a needle alone, this is non-sterile. So in this, what you do is just insert the needle and move back and forth so that you are pricking more number of areas into that lesion and then withdrawing it, attaching to the syringe, transferring it to the slide. A non-sterile one is the needle with the syringe. What you are going to do is a syringe and the needle is attached, and before inserting it and draw the plunger, have air in the syringe and fitted with the needle itself, straight away piercing this the lesion and then taking moving back and forth, taking the material and then transferring it into the slide with the air already present in the syringe, which is a sterile technique of taking an FNAC. And then after taking the FNAC or the impression smear or the sellotaping, for the staining, different stains which are very commonly used, we can even have it in our clinic and then we can go for it. The more commonly used the worldwide is Diff-Quick stain. Of course, the Diff-Quick is very costly and it's not freely available in India. An alternative one which we use in our clinic and most of the vets in India also, they are using this field stain, which is very cheap, very commonly available. You can use it. The other stains which are very cheap can be used is methylene blue, Leishman, Giemsa, and lactophenol cotton blue for the fungi. As far as Leishman and Giemsa, it's a time-consuming one. In practical conditions, you may have to wait for 20 to 30 minutes for the staining to happen and then do it. Whereas in Diff-Quick and the field stain, you can just see the slide in a minute itself after staining it. Of course, in methylene blue, in 2 to 5 minutes, the staining is completed, which you can see it in the clinic itself. Of course, these are all the common stains which we are using it. Methylene blue, Giemsa, Leishman, and of course the Diff-Quick. Of course, I have not used the Diff-Quick, and of course it's one of the good stains used worldwide. And then the field stain, which is very easy. I thought what I'm doing, I can say it. It's cheap, it's quicker staining, and what you have to do is prepare the smear, fix it in methanol for 30 seconds, and then dry it. After drying it, dip it in the Fields B strain, either in a Couplings jar, or you can even pour it on the slide itself, wait for 5 to 6 seconds, wash it in running tape water, and again dip it in Field Stain A for 10 to 30 seconds. Again, wash it in running water, dry it, examine it, you can see wonders in it. And these are all the ones which we have seen in our clinic using the field stain. A small a growth in the tip of the penis. Now, when we saw it had these plasmacytes, may go in for a plasmacytoma. And of course, you can see this a bunch of Malassezia organisms taken from a ear swab stained with methylene blue. And again, this TVT you can see it again with the field strain, and then again this one. Now we encountered a case where very recently having a cystitis, a hematuria, when we were able to look into this stained with the urine sediment was stained with it having these tumor cells which are benign, confirmed by our pathologist. And very easily you can do these type of stainings on the dog's table itself or in our clinic itself using these stains, which will aid us in diagnosing most of the conditions. Of course, the other useful test, but not a Petside one, hemogram. The hemogram also gives us a clue in aiding the diagnostic conditions for the skin conditions, biochemistry, the culture test, biopsy. Of course, for these things, we need the help of a laboratory or a good infrastructure to go in for these things. But before doing all these things, with the other Petside test which we discussed will be very useful in diagnosing most of the conditions. And of course, I think I have finished my things. Thanks to my credits, my colleagues in my clinic who helped us in getting these the pictures and the materials. And of course, more thanks to my daughter who helped in me in creating this PPT, and then in the conduct of the webinar also, she is besides me helping me. Thank you. Nathan?
Yeah.
Grossed into your presentation.
Close my presentation. Yeah, I'm doing it. Okay.
Nathan, question?
Yeah. Number one, and the basic question which has come from one of the veterinarian is, can you give us a 5 steps wherein I can diagnose a dermatological infection as soon as a case enters my clinic?
Yeah, that's what we have discussed, the history taking, it gives us more clue, and then the code brushings gives us an idea what type of parasites they carry on the body, and then a scraping or a sellotaping gives us an idea, and cytology gives an idea of the infections, whether it is bacterial or fungus. Even in bacteria, the cocci or the rods also can be diagnosed using a cytology on the clinic itself without going in for any laboratory.
Any lesion-based diagnosis for differentiating mites?
Mites, of course, the lesions now we can see. Now, whenever you have any problem in the tip of the pinna, you can suspect for Demodex. The scabies, sarcoptes, tip of the pinna. And then normally, as far as scabies and Demodex, you can see the scabies will be there on the backside of any lesions, right? Like a hawks and other things. On the backside, you can see the scabies, and in the front side, it will be Demodex. And then in Demodex, you can see a localized one invariably around the eye and in the face in the 4 digits as far as localized. And then, of course, anywhere in the body for a diffuse or a generalized demodicosis we can see. And Kyliatella, you can see it on the dorsal side of it. Oral mite, mostly in the ears, whenever you have any pruritus in the base of the pinna, or as I gave that auditopedal reflex, will give an idea of the oral mite also. Of course, notoderus and sarcoptes, the symptoms will be the same of pruritus in the pinna and in the entire body, mostly in the ventrum and in the axillary region.
Right. Since you are there down south, any heartworm and its correlation with dermatology?
In fact, so far I have never encountered any of the heartworm. Even the other diarrhea, which is very common in Kerala, even though I'm closer to Coimbatore and more number of dogs visiting Kerala and in Coimbatore, I have not seen a single case of a heartworm, so I'm not able to comment on that. Probably Dr. Nagarajan may aid in it.
So do you want to add on, or you'll do it at one go?
I'll tell later. You finish up the questions.
Yeah. The next question is from Dr. Rajesh. He says, kindly guide us how to diagnose and suspect atopic dermatitis in the field conditions, and how to differentiate from other skin diseases.
Of course, atopy. Of course, you have to rule out all the other things like coat brushings and then sellotaping, combing, scraping. Rule out the mites and then look for the lesions. As far as atopy is concerned, the lesions will be there. Recurrent malassezia otitis, and then lesions in the axillary region, and the lesions in the perineal region and in the ventral region, and more of in the digits. So whenever you have the lesions like otitis, pododermatitis, and pruritic lesions in the perineum and axillary, out of these 5, even when you have 3, and then when you have ruled out all the other mites and the parasites, it could be an atopy. As far as adverse food reactions, you can see more of the in the pruritus in the anus. Of course, they also have a combined with atopy. They may cause the other problems. And similarly, the flea allergic dermatitis and atopies are also commonly seen both together. But we have to go for the basic test. Now that when you rule out all the parasites, and then when you have lesions in the ear, digits, perineum, and the axillary region, it could be an atopy. Of course, you have to go for the other test to confirm it, but you can suspect for atopy when you rule out all the other parasites.
Right. Any allergen test possible in the field scenario?
Allergen testing, of course, we don't have the canine specific allergen testing in India. Now, when it comes, probably we can look for it. But right now, I don't have an idea of it because I have not done it. I have seen some of the people doing with the human allergen testing kits, but they say it's not so specific for the pets.
Okay. That I think brings us to the end of the questions, and I request Dr. Nagaraj to add on, and then we can sum it up.
Thank you, Dr. Venkateswaran, for your wonderful presentation. I think most of our people are benefited out of it. And here I want to add something related to the topic which were discussed. So the dioscopy, what he was telling, very simply we can take as a interference as if it is going to be blanched, then we can consider it as a skin related disease, like any superficial pyoderma or anything which is related to skin, which will have a blanching effect. Whereas if it is not going to get blanched, it will be related to bleeding disorder effect. So the bleeding disorders like disseminated intravascular coagulation or anything which is related to bleeding will have a non-blanching result. So that is why we have to do like that. Then tape impression also one of the important. See, you have to consider 2 things. One is skin scraping, another one is skin tape cytology. Cytology in any form. So skin scraping and cytology are 2 eyes of the dermatologist. See, any dermatology work, we have to do these 2 things as an important thing, as a primary important things. Then only all others. First, we have to do these 2 things, and in that we have to consider this tape impression as very carefully we have to handle. See, sometimes the demodex will be very severe. See, whenever it is going to be very severe, most of the time when it is presented to us, it will be in the very last stage or a very huge stage. At the time, whenever you are going to have a tape impression, you will be having a positive result. Whereas if it is going to be an early stage, so at that time it may not be visible in the superficial layer, it will be visible only, or it will be available only in the root of the hair. That's why we are insisting to go for deep-seated skin scraping. So the deep-seated skin scraping is very, very important in Demodex. Even though you are going for tape impression, suppose you are not getting anything in tape impression, you can very well go for the deep-seated skin scraping. But if once you are going to do skin scraping, it is better to go for deep-seated if it is going to be a Demodex suspected. So that is one thing I wanted to stress. And somebody was asking about the lesions based on the diagnosis for mites. See, very well, he was telling about it, the ear, pinna, elbow, ventral chest, rat tail, all these things are related to scabies, and Demodex anywhere it can occur, mostly in the facial region. Like that, we have got a lot of interference. No doubt, lumbosacral distribution is with the flea allergy. Then any mite or any fleas or any insect which is going to be there on the body, it will be on the top line. That's why the walking dandruff chelatula is there on the top line. So the top line will get affected many commonly in the flying insects. When they are going to attach with the body, it is easy for them to attach in the top line. So that's why it is very commonly seen in chelatula and the top line dandruff, walking dandruff, what we call as. And somebody was asking about the heartworm. Of course, we do have any internal worm nest infestation like other worm infestation. We have dull coat, hair loss, erythema in different parts of the body, but not necessarily in all. Intensity vary depending upon the severity of the disease. See, we'll be having a different type of presentation as a major issue. So owner may be addressing in a different way. That is the thing. Then atopy, as doctor was telling, we have to rule out the basic parasites and other causes. Then we have to apply favorite et al. Criteria. That is 8 points what they have given as indoor, whether animal is kept indoor, whether the onset of lesion is less than 3 years, or it has got a front paw lesions, it has got a ear pinna erythema, no ear margin lesion, no lumbosacral lesion. Like that, we have to identify, or the without any lesion animal was having the pruritus for a long time. All these things are important clues to identify. Out of 8, if it is going to be 5 positive, then we can very well suspect and go for steroid responsive or not. If it is going to be responsive steroid, we can very well go. See, initially, if we are giving steroid even in food allergy, it will be very much responsive. But later, it won't respond, because if it is going to be a food allergy, if you are going to remove the food only, it will be all right completely. Whereas if the atopy is going to be there, if you are going to give moment you give steroid, and if you are going to give steroid or any immunosuppressants, it will have complete control over it. That is the difference. Then as the allergy test, we have to find out various parts. We have got a wide range of allergens in all over the thing. See, for Chennai it is different, Coimbatore it is different, Delhi it is different, Bangalore it is different. So we have to identify the pollens or vegetations in the area in India. Since it has got a wide variation, we have to work out in it. Only the scientist has to do it. We are working on it. The association is working on it for the complete mapping out of pollens and allergens in India. Maybe in future we'll be getting it, and we'll be having a top list of allergens in India, and we will request the people like Intas to come forward to prepare the allergen and anti-allergens to create it. So that is what I wanted to stress, and everything went on well. And I really thank for the entire team, and also the great speaker, Dr. Venkateswaran, for this wonderful presentation. Thank you. Thank you very much. Thank you.
Thank you again, one and all.
Thank you to all. Thank you to the audience. Thank you to the speaker, and thank you to the entire organizing team of IAVD. Thank you.